the patient's condition, symptoms, treatment, and then they can insert their record in a system as the direct care providers. Right. According to this Ministry of Health, the guideline for assessing this electronic health record, it is defined that electronic medical record is digitally documented information about the health of an individual recorded by a doctor or other healthcare professionals. This medical healthcare providers. And this digitally documented patient information can be shared across the different healthcare discipline and setting. Okay, so the patient has the right to expect that there will be no disclosure to all or all of the information to person without the patient-provider relationship unless he or she give the permission. Therefore, there is a responsibility on the part of the custodians and users of the medical record to ensure that confidential of medical record is maintained at all times. And this is done by having a clear policy on user access control, according to the Ministry of Health guideline. All right. Okay, the concern of confidentiality and the security of digitally documented patient or health-related information. For the Ministry of Health has formulated this policy as the policy for control of access to patient information by users of hospital or clinic information, which you can access in this MOH website. All right. If you access this information on the policy and guideline, you will come across all the various guidelines for policy on access to patient information. Right. Challenges and issues in relation to adopting this electronic health record in the healthcare setting. Incidents can occur due to the electronic health record system interface issue or improper documentation or input by the healthcare provider, by the doctors or nurses or other healthcare members. And the use of these advanced technologies such as eHRs cannot improve healthcare outcome if it is not accepted and utilized efficiently by the healthcare professionals. And as highlighted by this researcher, nurses' attitude towards eHRs at their workplace can be influenced negatively by the lack of exposure or experience as students. I'd like to quote the Chief Medical Informatics Officer of this Untitled Hospital, which is adopting 99% of electronic health record, mentioned that going paperless is not without its challenges. Before the system went live, the challenge was getting the user requirement, making sure that people can agree on the workflow, and building on the workflow and training them to use that workflow. And doctors had to be trained 4 to 6 hours to use the electronic medical record system, while training for nursing staff took a day. So training is required. Let's see the issues and challenges. So, okay. As for our nursing student, whether in this faculty or any other faculties, any other IPTA or IPTS in Malaysia, our students, their experience of documenting the patient or health-related data are normally paper-based on form or chart, right? Okay, well, so in preparation for future-ready nurse graduates, it is important and timely to prepare nursing students to be future nurse professionals who can accept and utilize the electronic health documentation proficiently and effectively. Right. Early exposure on the use and application of eHRs and potentially safer patient care delivery would positively influence their acceptance and appreciation of the technology. And it would help in preparation of the future-ready nurse graduate. We are to help the graduates to adapt more quickly to the real clinical environment, demonstrate better clinical performance, and have more confidence on the use of eHRs in the workplace. And familiarity with the system would be fundamental needs in the workplace in this present decade. Okay, in preparation for future-ready nurse graduate, in responding to this call to provide nursing students with early exposure and experience with eHRs and to integrate eHRs as part of nursing teaching learning, we have initiated and conducted a scholarship of teaching learning or SOTER project in UNIMAS and development of a functioning web application for students to experience and to navigate the technology in documenting and planning care for virtual patients will be timely and beneficial. So a team of us was formed to work towards achieving the following three objectives. First is to develop a functioning web application for simulated electronic health documentation by nursing students in UNIMAS. Second, to integrate simulated electronic health documentation as part of nursing teaching learning. And lastly, to explore and determine nursing students' experience, perceptions, attitude, and intention to use the web application. These are our members in the team. Okay. For the first research project objective to develop the web application, which we name it as eHRs-UNIMAS. We have gone through the process of requirement gathering by visiting the local health center and the IT experts input and assisted with hosting of the web application in the server, input of form module details for entry of virtual patient data related to health assessment, medication prescription, administration, patient vital sign intervention, progress note, nursing care plan, etc. And the web-based application eHRs-UNIMAS was developed with the goal to provide students the experience and exposure of navigating the system, to cultivate among the students the awareness and attitude towards technology and patient safety. Potentially, this will help students in the transition to the real clinical environment to be more effective and confident. All right. I will briefly go through with you the functions and features which simulate some of the real-world EHR system in the web application which has been developed. Okay, right. Very briefly, the feature and function consist of including the user login access, user management, audit trail or logs of all instances of access by the user, form module management, patient management, entry of data real time, cost management, and to save, download, and print file. Okay, I will go through the functions and description when I show you the system in a while. All right. To outline to you the general flow process and to use this simulated web application system, we will start with course registration of the students by a lecturer and patient, and after that, patient registration by a student and health-related documentation for patient by the student, which can include nursing history, physical examination, nursing care plan, progress note, nursing assessment, observation, nursing intervention, medical administration, etc. And student proceed to do a patient case study summary and can download or save a file as a report for the lecturer to view or to mark. All right. The next few slides I will is a print screen of some of the page workspace that you can see in the web application. As we log in, this is what you can see in terms of on the dashboard with all the management, cost, patient setting, etc. And the modules of forms, medications, assessment, nursing intervention, case study, and resources, and with feature for lecturer to attach file. And then here, right in the front here, this is the audit trail or the activity log for the users, which can be shown in this page. And then a record of the number of patients that has been entered or registered by student, number of students enrolled, and the courses, number of lectures will be shown on the front page. And this is a page on telling you about different modules of forms, different forms in one module. Example, on medication and free prescription, you have drug prescription, nebulization chart, parental free prescription, patient admission, hospitalization, you have nursing assessment, physical examination form, you have care plan, progress note form, and then vital sign modules, you can have see a different type of forms and chart that can be clicked and attached to a patient. And the nursing intervention documentation like dressing chart, IO chart, position chart, etc. And for the patient admission and hospital form module, you can click on the form that is required and you will further expand and can do the documentation accordingly. All right. A print screen to show you if the students has download a file, their record, the patient care plan record is presented in this way, right? With the nursing problem goal intervention and evaluation is done by the student. All right, on the vital sign and other assessment form, you just have to click on the form or chart and then expand it and the student can do the documentation. Just such as pen assessment, which the student can access, document, and save regularly, accordingly. All right. After this, I will just share with you or show to you the website in this link, okay? Right. Okay. This is where you can log in as a lecturer or as a student. Right. The lecturers log in and the student log in to indicate that they have a different function, right? The login requirement include a PIN number and a password for security reason. And then user management, uh, there are two different role and function. For the students, it's like simulating in the real world the staff nurse with the role for patient care to access to enter patient clinical data, physical assessment, nursing intervention, and progress note. Whereas the lecturer, it will simulate like matrons, sister in charge of the unit or the doctor. They can read, audit what the student or what the staff has documented. So in this system, the lecturer is able to view and comment what the student has entered, but they are not supposed to be amending the data that has been entered by the student. Similarly, in the real world, the matron cannot audit or edit what the staff nurse has documented. Okay, so in terms of this activity log or the audit trail, it details the person, the date, and the time that the system has been assessed and activity recorded. Well, this is for in the real world, simulating the real world for audit trail of the user's activity. And the four modules, in these four modules, okay, depend on the patient, the type of patient come in, and patient come in, they can click to add a form for the patient required. Then they add the form, and or they can add the forms required. Need a form to be added for nursing care plan, so they can click this form to be added for the particular patient and do the record. Okay. All right. So this is okay. Right. Depend on the patient's condition and needs, the relevant forms are added. You may add in the observation chart to the patient that you can search here. Okay. And then you do the record accordingly. All right. Okay. So, okay, this is about the four modules. How about the patient management? Patient management will be for the lecturer if they want to add a patient, for their students, for their practice to add a patient, and then they can add a patient scenario and ask the student to do the assessment and nursing care plan. They can do that. But for the student, they can also add a patient for the course, for within the course that they are enrolled, and they can add a patient for their case study and do the assessment and intervention accordingly. Record, no? All right. So after the student have done the record, example, in the list of patient, the student want to send the report to their lecturer. They can click onto the report and download as a file. Okay, this is the record in the nursing history and physical examination form which the student Vanessa has done. Right? Okay, this is relevant when the student is doing health assessment, assessing the patient, even for the patient, the case study. And they can download this as a file to be saved in the desktop or anywhere. And this document file can be forwarded to their lecturer to be marked. So the student has completed his or her assignment to the lecturer for their marking or the assess for the either for the practice or the assessment. Okay. So all right. So we go back to this. I would like to show you in terms of medication and free prescription, simulating the real world medication prescription, which is supposed to be done by the doctor, right? But in this system, we allow the student, for the sake of doing their case study and for the sake of practice, they can add a form for the patient, okay? Then, so okay, then they can add the drugs. They can do the record, update the administration record for the medication that they have administered. Example, okay? All right, this is just briefly demonstrate to you that the real-time administration of medication record in the system, which in the real system, if the hospital is practicing this electronic health record, this could be done. And so this form a practice or experience for our students in terms of using electronic health record. This is for administration of medication. As an example, yeah. All right. So similarly, for all these different modules, what the student have to do is to first they have to add the patient, add in the form that they need, and then do the recording accordingly. It is simulating like when at the moment, like in the hospital here, the patient's record is still using files, forms, and chart. So whatever charts or form that is required, they are required. The nurse will go and take out from the file, from the folder, and then insert it into the patient's file record. Okay, so when using this electronic health record, we expect that the various form and chart will be minimized, or it can be paperless, or if it is not paperless. It is either paperless without the use of paper, as in Teng Phong Hospital, it's just another example, it's 99%. That means they are not using paper, but certain hospital may be using for certain, for example, medication or hospital patient admission, they use a computer system, but they're still using some forms and chart. So, but they are using less paper or paperless, right? Okay, now, all right, I will. Okay, our first objective, so far we have achieved the first objective, which is to develop the web application, right? Subsequent to the completion of this application online, is live now, is working. So our subsequent objective is to integrate this simulated electronic health documentation into the nursing teaching learning activities, right? So our approaches involve, number one, preparing the students. Second, the course coordinator's role and students' role, and identifying courses to integrate the related activities. Okay, in terms of preparing the students, we have provided the online briefing, introductory session, and the user guideline to facilitate them in navigating the system. So, enrollment by the course coordinator of the identified nursing courses by the lecturer. Enroll the student to the identified courses. And second thing that we have done is for the course coordinator to create either to create a virtual patient's care scenario for the student to assess, interact, to do health assessment, to identify nursing problem, formulate and evaluate care plan as part of the teaching learning activity. Or they can instruct the students to practice health assessment on each other, on their friends, and to do documentation electronically. Or the lecturer can also assign the student to complete a case study of a patient cared for during their nursing practicum placement. So these are the three possible ways that a lecturer as course coordinator can utilize the system as part of the teaching learning. I just show you here one example of a case scenario which can be written in a PDF file and then attach it as a file, which the students can view it. Every student of the course can view the same scenario, and then the students are required to do the assessment to come up with the care plan, nursing problem care plan, and the intervention according to the patient's given scenario. Right. Subsequent to the lecturer's role is the student's role. Student will have to can document and set patient data, monitor the vital signs, patient progress, assessment, medication, administered nursing intervention, etc. They can view the entry. They can view entry by lecturers. Yeah, what I mean here is what they have entered can be viewed by the lecturers. And the simulating the healthcare related medical orders or treatment prescription, right? So either way, they can view what the lecturer has written. The lecturer can also view what the student has written. And student responsibility or role will be also to complete and upload the case study or assignment of patient during the clinical practicum. All right, I outline here the 4 nursing courses which have been identified by our group that lecturer or the coordinator can integrate the electronic health documentation as the teaching learning activity. is concept and practice of basic nursing for the year 1, health assessment in year 2, medical surgical nursing practicum year 3, and integrated nursing practice for year 4, right? So the health assessment course has been implemented in the semester 1 via the online non-face-to-face due to the current COVID-19 pandemic. And the web application eHRs was assessed and integrated as part of the students' teaching learning activity as planned. As you will see that if we can carry out or implement this activity for the 4 courses, it would imply that our year 1, 2, 3, 4 students would have got the experience of navigating or accessing the web application. So start from the year 1. Okay, the year 1 will continue with the year 2, year 3, and the year 4 will have the final year to have the experience. So with this in mind, if we can consistently provide the students their experience start from the year 1 throughout until the final year, they would have gone through the 4 courses with the activity on the stimulated electronic health documentation. All right. Okay, subsequent to developing the web application, integrating the system into the teaching learning activity, our final objective is to explore or determine the nursing students' the experience, perception, and attitude, intention to use the web application. All right, I would like to highlight to you or emphasize why we need to explore their students as user, their perception, attitude, and intention to use the web application. According to this technology acceptance model, there are interrelationship or inference of one factors to the others on the user with any computer system, according to Davis 1989, right? In this model or framework, it is shown that the users' perceived usefulness, their perceived ease of use or how easy to use a system can influence their attitude towards using the system. And their perceived usefulness can also influence their intention to use and the final decision whether they will use the system. So with this model framework which predict whether the students or as user they will be reluctant to use or whether they are negative or positive towards using the new system. So we had to explore, even start from the first group who use the system. So, okay. For this finding on the nursing students' experience, perception, and attitude, intention to use, I will request now Ms. Chai to present the next part here. Okay.
Thank you, Dr. Chan, and a very good morning to all. I will be sharing about the preliminary findings of users' experience of using the application of eHRs-UNIMAS. In last semester, We tried to integrate the use of the application in a core course for nursing students in UNIMAS. The course was MDJ 2133 Health Assessment. This is a year 2 course that provides students with knowledge and skills to perform health assessment. One of the course learning outcome is that we hope that the student can demonstrate the skills of history taking, inspection, palpation, percussion, and also the auscultation. And all this will require the students to document their assessment findings properly. We found this course is suitable for us to try out the use of the application among the students. Especially when all face-to-face practical sessions have to be cancelled during CMC all the time. The objective of our study were to assess the student perceived usefulness, perceived ease of use, attitudes towards using the application, and their intention to use the application. A briefing about the application was given to the Year 2 student at the beginning of the semester. All of them were given a copy of user guidebook during the briefing. They also signed up for an account at eHRs and have their own password to log in the application. During the semester, the students were encouraged to use the application to document, save, and print the assessment findings for the health assessment practical session. Because face-to-face sessions were not allowed, we were left with no choice but to come up with a plan of non-face-to-face practical session for this course. So what we did was, after the theory classes, we showed the student the videos of us performing the required skills. The students learned from the videos, and then they video recorded themselves performing the same skills, maybe on their friends or on their family members. Findings of the assessment skills were documented using the eHRs application, and they downloaded the file in PDF and upload together with the videos for our feedback. The student entered the data and generated the findings of a total of 6 health assessment skills from the application. While the students were encouraged to use the application to document or save the health assessment finding, it is not compulsory for them to use it. For example, there was no marks allocated and no penalty if they didn't use the application, because the participation of the study was voluntary. At the end of the semester, the eHRs acceptance survey questionnaires were distributed among the students using the Google Forms, and they were asked to complete the questionnaires. The eHRs acceptance survey question technology acceptance model, and it was used to collect the data about the students' perceived usefulness, perceived ease of use, attitude from a study in Singapore, and has a good internal consistency for each subscale and total subscale in the study. In the current survey, the Chromebook of range from for the health assessment course. All of them consented to participate in this survey. All of them used the application and generated at least one report from the application for submission. 90% of them were female. All of them aged 20 to 22 years old, except one of them was 33 years old. All of them have experience of using the computer more than 5 years. The first part of result is about the student perceived usefulness of the application. We aim to see if the student believe that using the eHRs would enhance their performance or not, and whether it is useful for them or not. Majority of the students, that is 84.62%, think that the application is useful for them during the practical sessions. From the interview, some students expressed that application helped them to complete their assignment more quickly. One of the students said, I find it easier for me to record the data in the application because I just need to click and I can type the word faster than writing, and it helped me to practice enter the data online. Another student described this. The application helped me to finish my work more quickly. I feel the report generated is tidy because my handwriting is pretty messy. Some of them described that the application improved their documentation skills as they can type the report and generated a printed report. The student expressed that they can practice using the application first before they work as a nurse in the hospital later. A number of the students perceive that the application is useful because they think that it can enhance the effectiveness of storing and accessing the data. One of them expressed this during the interview. The app is good because it can save patient data. We can access it anywhere and anytime. I think it can also prevent loss of data. It is paperless and we can generate the report in PDF. Another student said this. It is an alternative way to record data. If there is loss of hard copies, we can still retrieve the data online. The next part is about the perceived ease of use. We wanted to know if the student believed that using the eHRs would be free from effort or not. From the questionnaire, more than half of the students, that is 59.92% of them, found it not easy to use or operate the application. From the qualitative data, it showed that majority of the students described the application to be difficult to operate. One of the students said, "It is difficult for me at first because I was not familiar with it. After a few times of try and error, only I managed to key in my data." The application also unclear for some of the students because, for example, the student mentioned that the system is confusing because it has many hyperlinks. A number of the students expressed that although they needed to put some effort to learn to operate the application, but once they were familiar with it, they can operate it quite easily. For example, one student said this, "I need to put in extra effort to learn how to use it, but it's good when we already familiar with it." The student gave several suggestions to improve the interface of the application. For example, a summary pop-up page, inserting columns in the field section, and also suggestion to sync the patient biodata in every section of the subsection, and so on. We also look at the student attitudes towards using the eHRs. This part of the questionnaire assesses the student if they think that the application can help them in their performance or not. We assess if they are comfortable or not using it. More than half of the students, that is 53.85% of them, were found to have positive attitudes towards using the application. Data from the interviews show that although majority of them think that it is not easy to use, the application improved their performance in the practical session. One of the students said, "Even though it was confusing at first, I think the app is effective as I don't need to send hard copy." Another student mentioned that the printout report is tidy and systematic. Many of the students also think that it was easier to record the assessment finding using the application than using the pen paper. The student expressed that, "I managed to document the patient's information by typing. That's better than on the paper because I don't need to print out and write the report on the paper." One student also described that the app is good and simple in a way that she can edit her data entry. "It will be messy if it is on the paper," she said. Some students were happy with the application as they think it can protect the patient's data. While mostly positive attitudes were stated here, a minority of the students reported the negative attitude. One student said this, "It's a new thing that we need to learn. I feel the learning process is wasting our time as we were not familiar with it at first." Another student stated that the process of entering the data in the application is troublesome if compared to on the paper. The last part, we assess the student intention to use eHRs. More than half of the students, that is 58.85% of them, indicated that they will use the application in their patient care and management whenever possible. In the interview, all students described their intention to use the application if the lecturer asked them to use it. Some of them described that they would use it because they do not need to print out the hard copy. They like to type and click the mouse than writing using the pen and paper. And also their report would be more tidy if using the application. There was only one student mentioned that she would still use the hard copy as she is more comfortable using the pen and paper compared to using the application. In addition to assessing the perceived usefulness, perceived ease of use, attitudes, and intention to use the application, we also run a few statistical tests to look at the relationship between the variables in our study based on the proposed theoretical framework, that is the technology acceptance model. Logistic regression analysis were conducted to test if perceived usefulness, perceived ease of use, and attitudes towards using eHRs predicted the student intention to use the eHRs-UNIMAS application or not. The logistic regression model was statistically significant with p less than 0.01, and the model explained 41.6% of the variance in intention to use the application, and also correctly classified 56.9% of cases. The analysis suggested that positive attitudes were 5.37 times more likely to increase the intention to use the app. Also, perceived ease of use also were 2.23 times more likely to increase the intention to use the app. Besides that, a Spearman rank order correlation was run to determine the relationship between the perceived usefulness and intention to use, as well as perceived ease of use and intention to use. There was positive correlation between perceived usefulness and attitudes, and also between the perceived ease of use and the attitudes towards using the application. Increase in perceived usefulness or perceived ease of use will also increase the student attitudes using the application. These results suggest that the methods to encourage the student to use the application, as attitude towards using the application display a significant influence on the intention to use, lecturers may encourage the student to use it by giving marks if participating, providing feedback, observing their communication, or answering their question in a timely manner. In order to influence the student positively with the perceived ease of use, the availability of the ongoing IT support and reliable internet are very important. And hopefully by achieving this, they would accept the new technology for their learning. This study also found the attitude towards using the application to be positively influenced by the perceived usefulness. It is therefore important to emphasize to the student on the usefulness of this eHRs application. That's the report from my side. I will hand over back to Dr. Chan. Dr. Chan, please.
Right. Thank you, Chai, for presenting the finding of the user's perception, experience, and the intention to use. All right. That was very meaningful and insightful, actually, with the statistical analysis. Right. So now we want to, okay, how can we say from the survey finding? This survey finding among the first group of students as user, right? It's good, actually. We think that it's useful and important to improve the attitude towards the using the application and the importance of motivating them to use the system by giving them marks for their efforts, right? And so for their experience and perception should be taken into consideration for further improvement and redevelopment for a system with a more user-friendly features, right? So I would like to just make a summary of points that hopefully you can take home these points and at the end of this presentation. First is about this integrating of this web application, eHRs-UNIMAS, as part of the nursing teaching learning activities, enhances nursing students' learning of health information technology, and is in line with the Malaysian Qualification Framework version 2.0 learning outcome cluster 3D on digital skill. Okay, for those who are in the nursing program, IPTA or IPTS, either diploma program or degree program, you know that this is the one of the learning outcome which has been highlighted and expected of the teaching learning in the program. And it contributes towards developing future-ready graduates to meet the demand of the real-world associated healthcare demand with the healthcare industrial revolution for future role for a safe and improved healthcare provision. And web application is a functional feature for this simulated eHR integrated as part of teaching learning activity among the health science program in the Malaysian higher education has not been reported so far. It would be beneficial and timely an initiative to be considered by us. And of course, universities' management support and allocation of resources are vital to make it possible for the development of a meaningful web application for the simulated electronic health-related documentation purpose. Besides the experience and exposure of navigating the eHRs, during a time of COVID-19 pandemic such as now, when teaching learning is non-face-to-face, the web application provides an easy approach for students to submit their assignment online to their lecturers in the paperless form. Right. With this, we want to appreciate and we are very grateful for the following. The financial support related to the development of the web application under the grant, support from the UNIMAS and faculty management towards the integration of this web application as part of the undergraduate nursing teaching learning activity throughout this ongoing SOTEL project. And the technical support from the Center for IT and Development Service, CITDS, UNIMAS, to further improve the web application. And appreciation also to our developer, Ms. Pang, for her support and advice. Okay, we just show you. This is our faculty, our university faculty, and the CITDS photo that we have it here, and our team members again here. Yeah, with the references that we have listed here to support our discussion earlier on, right? Okay. So I will pass this time back to Charlene.
Okay. All right. Thank you, Associate Professor Dr. Chan Kim Gyeok and Madam Chai Lee Su for the creative idea and insightful findings. We strongly believe that this system will definitely benefit the teaching learning in times like this. Moving on to the Q&A session. If you have not done so, please, you may drop your questions in a Q&A tab on WebEx or the comment box on YouTube for us to compile and forward them to the presenters. We have received a number of questions from the participants already. Okay, there's a few questions for Associate Professor Dr. Chan. Okay, the first question, is UNIMAS the sole creator of the system? Dr. Chan?
Yes. Yeah. The UNIMAS, under our nursing program, we are the one who created this system as a team.
Okay.
So yes, UNIMAS is the creator, and the copyright is belong to the faculty.
Okay, thank you.
Sorry.
Yeah, thank you, Dr. Chan. Hope it answers the question. Yeah, it is. It actually answers the question. UNIMAS is the sole creator. Yes. All right. And then there's another questions regarding medication administration. There are two questions about that. The first one is about okay, medication administration. Is it through barcode scanning? And then is there any entry for medication administration given by and witnessed by?
Okay, thank you, Charlene. About this medication administration, actually, for our student in this system, they will enter the medication administration as a practice based on their case study, right? So there is a, yes, for the practice, there is a column for them to, they click for them to enter the time, to indicate the time that is given, and then give a remarks. There is no barcode. This is because it's not a real world system. It is for our teaching learning practice. There is no barcode, no barcoding or scanning. Okay, I mean in the real world, yes, when the hospital is like in Singapore, the one that we have been to, the administration of medication, whereby the staff nurse had to scan the barcode on the wrist of the patient, and then the patient's information, the drug information will be shown on the screen, and then to make sure it's the right patient, and then they administer the medication. And then after the administration, they had to sign digitally the medication given. For this simulated system, there's no barcode, no barcoding. Yeah.
Okay, how about the question on the entry for staff, the medication given by which staff and witnessed by which staff? Is there any entry for that?
We have not inserted the witness. Yes, only the who administer.
Yeah. Actually, thank you for this question. Actually, it's a good idea to create another. I mean, if we have a future version, we can insert this entry for witness. This is a very good idea. Thank you for the
take note of that.
Yeah. And then the fourth question, also directing to Associate Professor Dr. Chan. Okay, this is a bit long. Once the students key in the data and save, are they able to edit or amend? And will the previous data be deleted or still able to be seen in the record as deleted or amended data?
Yeah, this is about editing of data. Yeah, in this simulated system, we allow the student, there's an edit button. The student can edit if they enter wrongly. And then, so the previous data, if they have deleted, this one will in the activity log will be shown that student has accessed the system at what time for which patient. But the deleted data cannot be tracked in the system. So I understand that in the real world, editing of the data has to be given approval or have to give reason for the editing of data and has to be approved. Yeah. Okay.
Okay. So, all right. That is about amendment of the data. So this is just a simulated one. So yeah, it is. But at least we still can track the log, okay, of the system from the system. Okay. Move on to question number 5, also directing to Associate Professor Dr. Chan. Okay, is the eHRs-UNIMAS incorporated from the hospital system, or is it only used in UNIMAS?
Oh, okay. So this system, it is not incorporated from the hospital or any hospital. It is just a system on its own that we have created after we have went to the health center from our experience went to Singapore for the educational visit, attachment to the hospital. We see what are the features that has been in place in the clinical area and then the need. So we incorporate those features into the system. So it is a system that we have developed on its own, right? Thank you.
Okay, thank you, Associate Professor Dr. Chan, for the answer. And there's another question for Madam Chai. Madam Chai,
Yeah.
okay. How is this system being used in practical practice?
During the course of MDJ 2133 practical session, the student created their own patient and added the form to the patient created. So the most used form is the nursing history form for the practical skill practice. After they have entered the data in the form added, they can save the form and then keep the form in the system. They were able to edit the data after they have saved it. They can also download it anytime for soft copy submission. Yeah.
Okay. All right. Okay, thank you, Madam Chai, for the answer. Moving on to Associate Professor Dr. Chan again. Who can use eHRs? Can users outside UNIMAS use this system?
Those who are registered or enrolled into a course can access the system. But as the purpose of this system that has been created is for students' teaching learning experience. So far, we don't see the necessity or to allow anyone from outside to access the system unless we want to redevelop this. When we redevelop this application, we want to allow other developer or staff to view the system, then we can enroll them into a course. So it has to be enrolled to a course. Then the person can be a user to access the system. Yeah. So it has to be students in what I mean. Yeah.
Okay. Yeah, thank you. And yeah, there are another two questions. One is related to medication error. So a participant is asking whether this system is able to prevent, how much can this system is able to prevent medication error?
Okay, I answer this question. The system, how to prevent medication error. Well, we are teaching the student to make sure that the right patient are given the right medication at the right time, at the right route, and the right documentation. By using the system itself, still cannot, by teaching the student to use the system itself, still cannot avoid or prevent the risk of medication error. Because student or as a nurse, they may still pick the wrong medication for the medicine trolley, even though it's checked, it's the right patient. But maybe she can still pick the wrong medication from another bottle and give it to the patient. Either it's overdose or less dose given to the patient. So the use of this electronic health record system itself will still not 100% prevent or avoid the risk of nurses committing medication errors, actually.
Yes, I agree with Associate Professor Dr. Chan. Yeah, the actual practice is very important in terms of checking all the rights which really matters to prevent medication error. Yeah, thank you for responding to that question. And there's another one pertaining to legal documentation and medical legal issue, also directing to Associate Professor Dr. Chan. In case there is any wrong entry in this nursing progress or documentation, can it still be corrected? I mean, if it is upgraded to be used in, hospital use or perhaps in this system, whether there is any, function to do that after they've generated the report, can they amend?
Okay. In our future development or improvement of the system, we can add those features about editing or not to allow editing, and what is the mechanism if the student as a nurse need to amend or edit the data of the patient. So that will provide the experience to the students in real world. This is what is happening. Then data, once it's entered, you cannot simply amend or change unless there's a reason, supported with reason, and with another staff nurse or your supervisor's signature or name indicated there. So we can consider that feature, and actually we propose that feature actually in a new future development of the system based on the various feedback. Yeah.
Oh, it's great to hear that there will be another upgraded version. Yeah, in looking at what has been presented by Madam Chai, yes, it is good that there will be an improved version. We are looking forward to that. Okay, another one more question for Associate Professor Dr. Chan. Now, can this application be accessed from mobile phone? Associate Professor Dr. Chan.
I'm sorry?
Application be accessed from mobile phone? Yeah, I think somebody has to be muted. Okay, all right. Yeah, Associate Professor Dr. Chan, can this application be accessed from mobile phones?
Oh, okay. Yeah, about accessing the system for the mobile phone, at the present version that has been developed, it is not able to be accessed from mobile, but it is already in our plan. The next subsequent project is to make it compatible and accessible for the mobile phone. Yeah, it is in the. It is working. I mean, it is going to have those features.
Okay, then that's excellent. All right, and then there's another one also. I think you have mentioned a bit about this, but perhaps you can go in detail about the copyright of this system. Is this system copyrighted? Perhaps you can share about the copyright of this. If people want to use this, how is it? What they're going to do.
Okay. Yeah, the system that we have developed, we have registered, applied for the copyright, and it is copyrighted now. And it is copyright means it belongs to the faculty or UNIMAS. Yeah. So in case, I'm not sure, in case people are interested to access the system to be a user, maybe he or she can further communicate with us. Which we will convey this to the management and see what our arrangement is required for other institution or nursing program for other institution. If they are interested, maybe they can communicate with us, I suppose, and then we can bring it to the management and see what can be done. Yeah.
Yes, if any one of you wish to, utilize this system, you may contact Dr. Chan for this. And another question for the project leader, Associate Professor Dr. Chan. What is your future plan and any commercialization of this system?
Yeah, commercialization. Yeah, there is the potential of commercialization. Why not after we have improved the system? I think that is where the other institutions who are interested, they can communicate with us actually. Yeah. About commercialization. Yeah. Which we can bring it to the attention of the faculty management regarding the matter if there is any interested party. Yeah.
Okay, thank you. Thank you, Associate Professor Dr. Chan, for the answer. So a few more minutes left. Any more questions directing to Associate Professor Dr. Chan or Madam Chai? Perhaps if you would like to ask questions, you may direct your questions to by typing them into the chat box or the Q&A tab on WebEx. Okay, there is a question here. Let's see. Okay, in aspect regarding medication error, it can't be prevented, right? But it can be reduced. I mean, the risk of error can be reduced. And it has been suggested by the participant that the whole system can be collaborated with other departments like pharmacy. So, Dr. Chan, is there any future collaboration with, for example, the medical students? I mean, in terms of simulated our simulated system, is there any collaboration like the medical students that can enter their data in and it's connected or synced with the nursing students, and perhaps maybe in the future if we have pharmacy students, it can be also synced so that the whole system is like it's synced, it's interrelated. What do you think about this?
Yes, I think that is a good suggestion, and it was brought up in our discussion with our dean and the deputy dean recently. There's always this potential and possibility in the future whereby the system can be improved to allow the medical students to also access the system that will enable the interprofessional integration and collaboration. So in the faculty whereby we have medical students and nursing students, they can simulate the medical and the nursing members in the team, and then they can do the treatment order and do the medical student, they cannot carry out play the role of a medical personnel, and the nursing student can play the role of a nursing personnel. Yeah, this will be our future move. Which can be considered. Yeah, it will be very possible. Yeah, thank you.
Yeah, that's great to hear that it is going to be exciting, not only benefiting the nursing students and also the medical students, I believe. All right, there's another two questions. Okay, let's see. All right, is there any future plan to pilot study in actual hospital setting using your system? This is from a matron. Yeah, this is from a matron.
That will be great if there is this opportunity, but I don't think so, because the hospital Ministry of Health is working in the real world for the real patient with the real data. Okay, and then this is a teaching learning institution, so at the moment, I don't think there is a possibility, but maybe, not sure, in the near future when UNIMAS has its own hospital, possibly that the system can be linked to one of the unit or the ward where the student can have the platform to access some of the patients' cases that they can interact with the system with a real patient. So that one will maybe when the UNIMAS has its own hospital. Yeah, but maybe not, may not be in the Ministry of Health hospital. Yeah.
Yes, yeah. It will be good if we'll be able to pilot it and implement in our future teaching hospital, our own UNIMAS teaching hospital. Yeah. All right. There's another question regarding what are the challenges so far that, or perhaps this can be directed to Madam Chai as well as Associate Professor Dr. Chan, who has actively implemented this system among the students. So what are the challenges of this eHR system? Perhaps Dr. Chan can go first before Madam Chai can come in.
Oh, okay. The challenges. I think to start with, the students need time to get familiar with the system. So we have to be ready to help them with answering that question or query. Yeah, that's why you can see that the student has expressed in their experience that the system is not easy to learn, a lot of steps, because they are not familiar with the system. Yeah, I'm not sure. How about Chai in your class?
Yeah, I agree with you that the student need to get familiar with the system because it is not easy, according to them, to learn how to add patient, how to add forms, and especially when it is implemented in my course that I coordinated last semester. I didn't force them to use the system because there is no marks allocated, and also I gave them the choice whether they want to use the pen and paper or the system. But all of them tried the system at least once to generated the report. So I think maybe if to encourage the student to use the application, we can allocate some marks in the course for them, I think.
Yeah, that would be a great idea. Yes. Okay, thank you, Dr. Chan and Madam Chai for answering that. And Dr. Chan, it has been asked, how safe is the system? Can the information be hacked? Because any data protection applied on this application, because leaking of patient data information is a serious case. And is there any cyber security, applied? Or any cyber security course on electronic health record apply in the future nursing course? This is about hacking the system, the patient's information being leaked. Is it protected?
Yeah. So the question is about the future. Any courses or education related to cybersecurity, is that right?
Yeah, there are actually two questions in it. The first question is whether the system is protected. Can it be hacked? Another one is there any course or education in data protection?
Yeah. Okay. This is the system for simulated health records. So we are only requiring a user ID and password to access the system. So there's always the possibility if we give someone with to have if we only someone with the ID and password which has been enrolled into the system can access the system. So if we don't enroll the person in, there is no, so far, he or she will not be able to enter the system. I mean, it's only that level of security. So if someone else is able to know how to have the IT know-how to go in without the password ID, there is a possibility, yeah, because we are not having any other high level of security system, right? It's only the user ID and password. Yeah. I'm not sure in the KKM or in the real hospital where they have very fully electronic system, healthcare record system. I'm sure they have another high level of security system in protecting the data. But for our system, which we have developed, it is only until that level in terms of the security measures. Yeah, in preventing people entering the system. And yeah, you're talking about the future. Any education will be incorporated. I think it will be useful, right? We can integrate information or talk to the student about the needs to maintain security and the possibility of being compromised in terms of the data security. But I mean, I did introduce or include this information to the student quite briefly, yeah, for each group of the students. Maybe we can have more in-depth teaching on that in the future, probably in one of the elective course. We can introduce an elective course about this information technology use application in the healthcare. Possible, right?
Yes, I think this is a very practical issue whereby, hackers, in the cyberspace, hackers are looming everywhere. So yeah, the protection and the security of the information is indeed very important. So yeah, I think in the future we could introduce, this kind of, security, cyber security course into our generic and elective courses in our university. Yeah, we can. Yeah, because our head of department is here, so yeah, he acknowledges about that. Yeah. Okay, and yeah, there's another question also related to the Ministry of Health clinics. Okay, any plans to expand the system to the health side, especially those clinic which is still without the tele-primary care system? Yeah, I think you have mentioned about that. Perhaps you can elaborate more on the health side, perhaps?
Do you mean that to have the feature in the system whereby not only the hospital patient care can have the system simulating the hospital care documentation. So I'm supposed we can have another modules integrated there whereby like you can simulate patient or healthcare related documentation for the community whereby community healthcare, like whereby you have immunization, child health. So you can have a child health assessment, immunization schedule integrated into the system, one of the modules where the child can come in for the immunization, and then the nurse can do the entry of their immunization schedule, injection given and all that, and the maternity, the antenatal mother assessment. Yeah, I think we can include those antenatal child health module into the system, into the new system.
Yes, that's a very good idea. As to whether the clinic can use this system, I think again it's subject to the ministry's decision or perhaps the MOIC's decision. If there is any need or the approval is obtained or whatever, then I think these processes you have to discuss privately with Associate Professor Dr. Chan with regards to the utilization of this system as it is copyrighted already. Okay.
Or for the new hospital, UNIMAS hospital or the health center to be up.
Yeah.
For the UNIMAS hospital and the health center, then we can actually try out the real practice.
Yes, that's right. Yeah. Okay. Another question: does this eHRs contribute administrative burden?
Sorry?
Does this eHRs increase administrative burden?
Oh, you're talking about with this integration of this system in our teaching learning?
Yeah. Is it going to increase the workload or burden? No, things
I
like
don't
that.
think so. I think it will make our teaching learning activity actually is more efficient. I can ask the student to do the case study and then they write up, save it as a file and send it to me, save their paper, and they just email to me if I'm the course coordinator. So with the paperless application being used, the system being used, we are saving paper too. Not only, may not be all paperless, but paperless. We have less paper. You don't need to send in the whole assignment in the 50 pages or 60 pages. Instead, you can just send a file. I mean, in terms of course coordinating, I don't think it's giving more work to the course coordinator.
Okay. All right. Okay, there is one last. Okay, it seems that we are running out of time. So the presenter will be taking the last question for this webinar this morning. So let's see. Okay. Now there's another, there's one. Okay, is this, hang on. Okay, is the system integrated? Can the system view the lab investigations reports, radiology images done for the patient? Is there any way, the X-ray could be available from the system, or the lab values and all the lab results being available in the system?
I think if the system is really developed for use in the hospital later, they can have those features to link the platform from one to the others, interdisciplinary nursing, pharmacy, lab for the, how do you call it, sharing of information. But not at the moment, because this is decided, which is only for our teaching learning. We only have this feature for practice documentation of nursing care plan, progress note, drug administration, and then write case study, write out and download file. Yeah.
Yes, thank you. Yeah, thank you for the questions from the participants. Yes, Dr. Chan, you are right. Currently, we are going step by step, where I believe this system is at its baby step. So I believe Dr. Chan and her team will definitely take all your recommendations and suggestions in, and we are going to develop and improve it and expand it as the time goes by. Ladies and gentlemen, we are sorry to inform you that the webinar is coming to an end. But before you leave this virtual platform, please complete the evaluation form via the QR or the link that will be provided in a short while for you to redeem an e-certificate for attending this webinar. And a friendly reminder, while filling your information in the evaluation form, please ensure that all your particulars are spelled correctly, because your name on the e-cert will be based on what you have entered in the evaluation form. And any request to amend after the issuance may not be entertained. All right. With that, we thank all of you for your time and participations, and we shall meet again soon, and have a pleasant weekend. Bye.
యూనివర్సిటీ మలయా మెడికల్ సెంటర్ కదా అది సెంటర్ TRE వస్తుందా TER వస్తుందా TREయా
Hello, excuse me. I couldn't enter the HTTP. Can you send the link to my email? Thank you. The problem is I using handphone. Now I at this car service center outside the hospital. Or maybe you can send to my handphone also can, or WhatsApp. Lai, yes, Dr. Lai, yeah. Which one? I couldn't find your chatbot here because it's only have switch speaker, find device, share content, check with everyone, toolings, auto only info, show statistic, setting, and proclaim post. This is the icon that I have. I think you send to my. Can you send to my WhatsApp, my handphone or WhatsApp? Or my email, either one. Yeah.
And that's you have an icon. You have an icon for chat with everyone.
yeah.
Yeah.
Yes. Okay. All right. I try this one. Yeah. Okay. Oh yeah, I'm able to get it. Thank you. I'm filling up the form now.
Mr. AB, are you still there? Can you just a quick flash on the next health talk, the one with Madam Dayang, I think. The next, just a quick flash and then coming back to here. Thank you.
She's sharing, yeah.
Hi everyone, if those who are still here, the next webinar will be organized by our own Faculty of Medicine and Health Sciences. It's the fourth health talk series by the faculty. It's open to all to the public. It's about understanding dementia, the person, the caretaker, and the community. It's on the 22nd of April, 2021, 9:30 to 11:30. So it's presented by our Department of Nursing. There will be one moderator and two panelists who's actually have a massive background on dementia as well as gerontological nursing. So hopefully to receive all of you to join us for this fourth health talk series. Yeah, thank you. It will be on live on the faculty Facebook and YouTube, right? So you can just click like on our FMHS UNIMAS Facebook page, or you can follow on the FMNHS YouTube link for this health talk series. All right, thank you very much.